afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Ducalo, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers. Glad to have you along as well as members of the media, and as always, if this is your first time joining us, we'll just go over how you can ask your questions. All you need to do is click on the Q&A icon here on Microsoft Teams. That's the question mark inside the text bubble at the top of the screen. And when you do submit your questions, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are watching on the CTV London website. Well, let's get to our opening remarks right away, and we'll start this afternoon with Mayor Ed Holder. Mayor Holder.
Well, thanks very much, Dan, and good afternoon, everyone. You know, we just celebrated this past week National Public Health Week, where we honored some pretty amazing people, both, you know, it's interesting, it was everyone associated with public health. So we were talking in terms of certainly our frontline folks. We were talking in terms of our behind the scenes individuals, like everybody who have come together to truly make a difference, and in particular here in London and Middlesex. So this gives me an occasion as well to say this. So we have this 1 week for the first time ever, this public health week. But this should be every week we honor and celebrate the great work they do. And I really want to say how grateful I am. And I know I speak for all the citizens of London, and if I may, Middlesex, when we say how much we appreciate public health care and the work that's being done. So bravo to all of you. And now I'll add to some formal comments if I can, because just a short time ago, we learned the province is making antiviral treatments and PCR testing more widely available. But for those who might have missed the announcement, PCR testing is now available for anyone 18 and up who is immunocompromised. It's also available for individuals age 70 up, those age 16 up with fewer than 3 vaccine doses, along with individuals age 18 and up with fewer than 3 vaccine doses and at least 1 chronic medical condition. Go to the Health Unit's website for more information, because that can sound a little bit confusing. In addition, though, the province is allowing select pharmacies to dispense antiviral treatments with a prescription starting later this week. A full list of participating pharmacies will be available first thing tomorrow morning. Obviously, as case counts and hospitalizations trend higher, there's no doubt we're in the 6th wave. Ontario's Chief Medical Officer of Health said earlier today it won't settle until mid to late next month. In the meantime, I was encouraged to see so many Londoners begin to take advantage last week of expanded access to 4th doses. I made a point of going to the Agriplex on the weekend, and I was exceptionally impressed with the long lineups. Normally, that's not something we celebrate, but in this case here, it's a testament to the fact that what matters most of all is to get your vaccines. In case you missed it, anyone age 16 over is now eligible for that 4th shot. And even if you've already had COVID, I would strongly encourage you in that age group to make an appointment. I know you're probably getting tired of hearing it, but vaccines are far and away our best defense against the worst outcomes of COVID. 2 shots aren't enough. Everyone should have at least 3, especially with this subvariant. And if you're over 60, look, make sure you get your 4th if you haven't already. With widespread availability of vaccines and expanded access to antiviral treatments, I absolutely believe we're in a tremendously better position today than we were this time last year. And the other thing you hear about masking, you know that it is not a requirement anymore, but we are absolutely encouraging in public settings, internal public settings, to please wear your mask. It's just prudent. It's just smart health. Look, I expect a better spring, and I look forward to an even greater summer. It happens with your support and your cooperation. Thanks so much. So look, I'm going to stop right there if I can, and I'll turn this now over to Dr. Summers.
Thank you, Mayor Holder, for both your kind words and for your ongoing support of the measures that will help protect our community through this pandemic. The Middlesex-London Health Unit is reporting an additional 59 COVID-19 cases today and one additional COVID-19 related death today. The death occurred in an individual in their 80s who had received 2 doses of vaccine but had not received a third. Over the weekend, there were 107 cases reported on Saturday and 100 cases reported for Sunday. There's now been a total of 35,107 COVID-19 cases in London and Middlesex since the beginning of the pandemic. The number of COVID-19 related death now stands at 366. These numbers, in addition to the rising numbers across the province, as well as the rising viral load within our wastewater, continues to remind us that this pandemic is not over. COVID-19 continues to circulate in our community, and the risk of transmission at this time is very high. With the risk of infection being so high right now, as well as the growing number of cases and increasing presentations to hospital, we all have a critical role that we must continue to play in reducing the effects of COVID-19 and our risk to ourselves and those around us. The best things we can do are those practices that we've already been doing for so long now, and the ones that we've come to know to be familiar for us and easy to implement, even if no longer required by the province. At the MLHU and for our region, we continue to strongly recommend the following actions in order to protect yourselves and those around you against COVID-19. Wear a mask in enclosed public spaces. Ensure that you are up to date for all recommended doses of COVID-19 vaccine, including a booster dose for those 12 and older and a second booster dose for those who are 60 and older. Stay at home if you are unwell or develop any COVID-19 symptoms. And if you test positive for COVID-19, self-isolate and stay home for at least 5 days after your positive test. Please consider your risk and the risk of those around you when you make plans to gather. The risk is very high that someone may be incubating COVID-19. So think about how you can reduce the risk of transmission of COVID-19, such as inviting fewer people to those gatherings or hosting events outdoors. Vaccination remains absolutely essential to protecting yourself at this time with such high risk of COVID-19 in our community. Last week, the province announced that those over ages 60 years of age and older are now eligible to receive a second booster dose. In addition, Indigenous individuals who are First Nation, Inuit, or Métis who are over the age of 18 and their non-Indigenous household members are also eligible to receive that 4th dose. In response to that announcement, more than 15,000 4th dose boosters have been delivered across the province. And here in Middlesex-London, since that announcement, over 8,000 appointments were booked in our system. You can continue to book appointments to receive the vaccination at the Western Fair District Agriplex in London or the Caradoc Community Centre in Mount Bridges. You can also get vaccinated at any of our walk-in clinics, including the one at White Oaks Mall, which is open from Thursdays to Saturday. For all the latest information on our clinics, please visit our website at healthunit.com. This week, we have clinics running at 3 London Public Library branches, including the East London branch on Tuesday, April 12th from 3:30 to 7, Jalna Public Library on Wednesday, April 13th from 3:30 to 7, and Beacock Public Library on Thursday, April 14th from 3:30 to 7. The vaccine remains available through many select pharmacies across our region as well. The province did announce today expanded access to testing and antiviral treatment, including Paxlovid here in Ontario. Building off the mayor's comments, individuals aged 18 and over who are immunocompromised, individuals aged 70 and over, individuals aged 60 and over who have fewer than 3 doses of vaccine, and individuals aged 18 and over with fewer than 3 vaccine doses and at least 1 risk condition are all eligible for testing and assessment for antiviral treatments. That means individuals in those categories are able to book an appointment at the Carling Heights Assessment Center. We're also anticipating expanded access of Paxlovid availability in pharmacies across Ontario. However, I would note that that is the availability of Paxlovid for those that have a prescription. So it is critical, again, that people who are individuals aged 18 and over who are immunocompromised, 18 and over with fewer than 3 vaccine doses and at least 1 risk condition, individuals 60 and over with fewer than 3 vaccine doses, and all individuals aged 70 and over consider presenting to the Carling Heights Assessment Center if they develop symptoms of COVID-19 for testing and assessment. Thank you so much for all the ongoing support of the health unit and of our community as we continue to focus on the COVID-19 response. It is absolutely essential that we recognize that the pandemic is not over and that we take these critical steps to protect ourselves and those around us. In one quick non-COVID update, I do want to note that April is Oral Health Month. Dental health is a critical part of our overall health, and it can have a significant impact on the overall quality of life. The health unit's dental clinic at City Plaza provides dental services for eligible children, youth, and adults. And those services include screening to determine eligibility for all public health programs, as well as referral to programs in our region. Take care of your teeth, enjoy those smiles, and we celebrate Oral Health Month this month. With that, I'm going to pass things over to Adam Duclos, Dr. Duclos from the London Health Sciences Centre. Thanks, Dr. Duclos.
Thank you, Dan, Mayor Holder, and Dr. Summers, and good afternoon to our media and colleagues. Thank you for having me here to share an update about COVID-19 at London Health Sciences Centre. As of this morning, we're caring for 47 COVID-19 positive inpatients with 5 or fewer in critical care. In our children's hospital, we have 5 or fewer inpatients and no patients in our children's critical care unit. We currently have 1 unit on outbreak. Over the weekend, we have started to see more and more the impact of this 6th wave on our healthcare system, and it is significant. We are seeing larger and larger numbers of staff who are off due to COVID and an increase in COVID inpatients as well. As an example, we were not able to staff all of the beds in our emergency departments over the weekend for a number of hours at a time. As a result, we may find ourselves in a position of having to consolidate or reduce services as the week continues, or having to transfer patients to our regional partners. If this becomes necessary, it will be communicated. There are challenges. These are challenges we're seeing across the region and are not unique to LHSC. But we also understand the very real impact of these challenges on our patients. We will do everything we can to mitigate our health human resource challenges in order to continue to provide safe patient care. Along with our hospital partners across the Southwest region, we would like to remind our community we will be continuing to follow the mandates we have in place. We will continue to enforce universal masking for visitors, patients, staff, and physicians. We will actively screen visitors, patients, staff, and physicians when arriving at the hospital. Mandatory vaccine policies for our staff and physicians, and maintaining our current care partner presence policy. We would also encourage you to visit our website to see a list of services that are available over the long weekend in addition to our emergency departments. I'd like to remind the public that the Carling Assessment Center will maintain its regular hours over the upcoming Easter weekend. You can visit our website to find those hours as well. Most importantly, I'd like to remind our community to follow the recommendations Dr. Summers just gave around things like masking and distancing. It is just as important now as it was earlier this year during the 5th wave, given the high risk of COVID in our community. Thank you, and I look forward to your questions.
Well, thank you very much, Dr. Duclos, Dr. Summers, and Mayor Holder. We do have a number of questions in the queue, so let's get to those right away. The first question this afternoon is from Jane Sims at the London Free Press. Dr. Summers, this one is for you. Ontario's Chief Medical Officer just said he's strongly recommending people wear masks, but wouldn't go so far as to recommend a new mandate. Given that one public school board says that it is dealing with 400 staff absences a day, that another board has seen staff absences triple, and that we have 2 London schools moving to online learning because of staff absences, are you disappointed that Dr. Moore didn't expand masking requirements to schools?
Thanks for that question, Jane. A few thoughts. I strongly, and as you've heard me say before, strongly recommend the broad use of masking in indoor enclosed spaces, public enclosed and closed spaces. Masking has shown to reduce COVID-19 transmission. It is, however, one component of a layered approach to reduce transmission. And when we look back over what's been successful in previous ways of disrupting transmission, masking has played a role, certainly. but capacity limits, physical distancing, symptom screening, et cetera, have also played a significant role. When we look at what's happening in schools right now, certainly transmission could be reduced in those settings with the use of masks. I would also note, though, that substantial transmission is happening outside of schools, and therefore we would need, I think, masking to be more broadly implemented and used in non-school settings as well, in order to comprehensively ensure reductions in transmission that are impacting staffing like what we're seeing. I want to see as much masking in indoor public settings as possible. And so I would strongly encourage individuals to mask in indoor environments. And as I've said before, organizations to consider the tools available to them in order to increase masking in their environments relative to the risk of COVID-19 for their attendees, participants, staff, or patrons. The province has challenging decisions ahead of it and challenging decisions already that they are facing with regards to the tools that they wish to use across the province. What I can comment on, though, is that certainly masking will reduce transmission, and therefore, in order to protect yourself and those around you, I strongly recommend the use of masks at this time in indoor, publicly accessible environments.
Thank you very much, Dr. Summers. Let's go to the next question, and it's a follow-up from Jane Sims. Dr. Summers, and I know you talked about this a little bit a few moments ago, can you give us an update on vaccination uptake? And specifically, are people 60 and older taking advantage of fourth doses?
Thanks, Jane. Yeah, since our announcement that vaccine would be available, and since the provincial announcement, we've had over 8,000 appointments booked, and we've obviously had people show up for walk-in appointments as well. I strongly recommend anybody who's wanting to get a fourth dose to make an appointment. It's the easiest way to make sure that you're not necessarily showing up and unable to get an appointment in the moment when you show up. So we have seen significant uptake. We are still waiting on coverage data, and it'll take a couple of weeks to really get a sense of exactly what uptake looked like amongst those age 60 and older. Prior to the fourth dose, about 80% of those 65 and older had taken advantage of that third dose booster. I hope that everybody who got a third dose in time gets their fourth dose. And particularly right now, who I'm most concerned about is those age 60 and older who have not yet even gotten a third dose. Those folks need to get their booster as quickly as they can. Please make an appointment. For those folks, walk in. It is amazing what that additional third dose booster will do for sustained protection against severe illness and ending up in hospital. As Dr. Duclos commented on, our health system is facing stress, not just from people coming to hospital with COVID-19, but from staffing challenges from the circulation of COVID-19 in the community. So anything we can do to lessen that burden, including getting our booster dose, is absolutely critical. We'll have more updates, Jane, on fourth dose uptake over the next few weeks as we give enough time for people to get in and get themselves vaccinated.
Thanks, Dr. Summers. And we did have another question from Jane Sims there.
I think we accidentally published it, Dan, so if you go to the published section.
Yep, I've got it right here. So Dr. Summers, would you consider making any Section 22 orders if the transmission rates remain at the high levels we're seeing right now?
Thanks for that question, Jane. The Section 22 is always a tool that's available to a medical officer of health to use. So I would never take it off the table entirely. What I would say, however, is that the Section 22 order is in place for an MOH to respond to a new and emerging and time-sensitive risk that requires a very urgent response. It's the type of tool that's to be used in a situation where elected officials at the provincial level don't have access to the information that they need to make the timely decision. In this instance, there is not a new and emerging issue that is specific to the London and Middlesex region for which the provincial authorities do not have access to that same information. So I do not think that a Section 22 is appropriate in this current context, and I don't believe that I, as the MOH, have the authority in the current context to use those Section 22 powers. The province has access to those that information and has made decisions based on the advice they have received. with regards to mandates, etc. So at this point in time, I am not considering the use of a Section 22.
Let's go to our next question, and it's from Sophia Rodriguez at CBC London. And Dr. Summers, Sophia's question is for you. Sophia asks, now that fourth vaccine doses are available to people over the age of 60, do you recommend anyone in that age group to get their fourth shot? We've heard from some healthcare professionals who have suggested a second booster will provide extra protection to higher risk groups, but not much more to those who are not and already have a third dose. What do you think about this? Also, and we asked you this before, what has uptake been like for fourth doses?
Thanks for that question, Sophia. Yes, I am recommending that those over the ages of 60 receive their fourth dose when eligible. And I am recommending at 5 months after you've received your third dose. The reasons for this are that we have evidence showing that antibody levels, which is one measure of immunity that we have, wane over time, and particularly at the 4, 5, and 6 month mark after you've received that booster, that immunity wanes. And some studies in Israel, for example, showed that waning immunity. Now, what does that mean with regards to the sustained protection against severe outcome and hospitalization? I think there's still some evidence that still needs to be collected there, but I'm confident that there will be some benefit, if not significant benefit, incurred from getting an additional fourth dose booster in order to jumpstart your immune system again to have sustained protection against COVID-19. I think that additional protection, given the high circulation of COVID-19 in the community, is worthwhile, particularly given the very, very, very minimal risks of getting vaccinated against COVID-19, particularly for those that have had no issues with the vaccine to date. So again, I continue to recommend that those over the age of 60 get those booster doses and get their second booster doses at the appropriate interval.
There's a next question from Sawyer Bogdan at Global News Radio 980 CFPL. Dr. Ducalo, this one is for you. And I know you alluded to this a little bit in your opening remarks as well, but Sawyer's asking, how is the number of hospital staff testing positive having an impact on services at LHSC?
Thanks for the question, Sawyer. To date, the biggest impact of increasing staff cases is an increase in the stress on our team members are already experiencing and increasing that. Less people looking after the same number of patients. Prior to this wave, staffing constraints had already impacted our ability to get back to 100% of pre-pandemic scheduled surgical volumes. We were sitting at about 90% as of last week and continue at that level today. We are doing everything we can to not have to reduce scheduled services in the coming days and weeks, but it has to be on the table given the staffing constraints we're experiencing. I mentioned in my preamble that over the weekend, one of our emergency departments, there were a number of stretcher spots closed, and it was overnight on Saturday night. And that does impact services in that when there's less spaces to care for people, the wait times can become longer. And that's just one example of some of the stress and strain on our people and on our space across LHSC.
Thank you, Dr. Ducalo. Let's go to our next question. And this one is also for you, Dr. Ducalo. It's from Jerry Dewan at CTV London. Dr. Ducalo, we have heard some patients from hospital in St. Mary's may be directed to LHSC because their shortened hours due to staffing shortages. How well positioned is LHSC to accept these patients, and what are the impacts of staff LHSC COVID-19 cases? We've touched on that, but certainly the transfer question is there.
Absolutely. So, unfortunately, as I mentioned in my preamble as well, many of our regional partners are facing the same health human resource challenges we are at LHSC. We are part of a larger system and we work regularly with all the hospitals in our area, whether it's St. Mary's or Ingersoll or Woodstock, St. Thomas. It is likely that some of the patients that would normally have been cared for at St. Mary's Hospital in St. Mary's, as opposed to St. Mary's in Kitchener, will end up in neighboring emergency departments like LHSC or Ingersoll or Stratford. I'm not sure the actual number of incremental patients we have seen to date related to their intermittent closure, but I suspect there are at least a few. Are we ready to handle it? Well, I would say we are, but as I mentioned, we're stressed and strained, and the entire system is. So we're not, we don't have all the staff we would like to have in order to be ready for this type of closure. But it's the situation we're in given how many cases of COVID are out in the community.
Thank you, Dr. Duclos. Next question is from Sawyer Bogdan at Global News Radio 980 CFPL for Dr. Summers. This is getting into some of the specific numbers. Dr. Summers, can you give us an idea how many Londoners have received a fourth dose since eligibility expanded?
Hi, Sawyer. We don't yet have a clear picture of that, again, partially because of the early days that data has come in. We will be updating our dashboard to provide fourth dose coverage through the population. The wheels are turning on getting that data field added to our dashboard, so we will be able to provide that data in good time.
Thank you, Dr. Summers. And let's go to the next question. And it's from Sophia Rodriguez at CBC London, and it's touching on the schools question again, Dr. Summers. Sophia asked, Dr. Summers, you're expected to appear at a special meeting with the Thames Valley District School Board tomorrow. The board tells us they're asking for guidance on how to manage COVID-19 in light of the amount of teachers and students becoming infected. Will you recommend mandatory masking at school? If not, what will you recommend?
Thanks for that question, Sophia. Yes, I will be at the special board meeting for the Thames Valley District School Board tomorrow evening, and we'll be happy to answer any questions the board may have with regards to COVID-19 and the tools available to them in order to decrease transmission within their contexts. With regards to masking, as you've heard me say today, I am strongly recommending the use of masks in public indoor settings, which would include schools. The question regarding the use of a mandate or not is one that the board will need to consider given the risks and benefits of a mandate and the risks to staff and students, given that students are, of course, younger. We know that the risks of COVID-19 are highest as you get older, and therefore kids are at lowest risk, but that's not zero risk. And so that's why we're continuing to promote and encourage vaccination amongst 5 to 11-year-olds, as well as the appropriate use of masks. The school boards will have a better understanding of their ability to institute mandatory masking relative to the decisions of the Ministry of Education, and I would defer questions about that to them. What I will continue to recommend to the board and to other organizations in our jurisdiction is that they continue to consider the tools available to them to increase masking within their contexts relative to the risk of COVID-19 to their patrons, attendees, staff, and clients.
Thank you, Dr. Summers. And let's go to, we've got a couple of questions here from Sawyer Bogdan at Global News Radio for you, Dr. Duclos. And I think we've answered one of those. Sawyer was asking how the number of hospital staff testing positive has affected services. We've talked to that, but she is asking again for the number of staff who are currently off due to COVID-19.
Thanks. We have 288 staff and positions off with COVID-19 at this point in time. So those are people that are positive for COVID. There's also a significant number that are off due to contact with COVID. For instance, if they have a child or something with COVID, they may still be off as well.
Thank you very much, Dr. Duclos. And that does bring us to the end of our questions for this afternoon. Thank you to Mayor Holder, Dr. Duclos from LHSC, and Dr. Alex Summers from the Middlesex-London Health Unit, as always, for your input, for your insights, and for the information you share weekly with the community. We will be back with our next virtual media briefing, not next Monday, but next Tuesday. We'll be taking Monday off for Easter. So we hope you will join us next Tuesday afternoon at 2 o'clock for our next virtual media briefing. So between now and then, have a great rest of your afternoon, have a good week, and so long for now.